Bienvenidos, welcome to my channel. Today I want to talk about the fat acceptance movement. This is a movement that people are pretty divided on social media, so I wanted to sit down and address it from a professional standpoint and a little bit of a personal standpoint too. So there are people on one side saying that the fat acceptance movement is positive, it's about promoting body positivity and so forth, and there are people on the other side of the fence who say that fat acceptance is really promoting an unhealthy lifestyle. So let's together dissect what the people and the data have to say. According to our favorite free encyclopedia, the fat acceptance movement, also known as fat pride, fat empowerment, and fat activism, is a social movement seeking to eliminate the social stigma of fatness from social attitudes by pointing out to the general public the social obstacles faced by fat people. We tend to associate this movement with social media, but really it started way before doom scrolling and swiping right was a part of our lexicon. For that, we can thank the National Association to Advance Fat Acceptance. The NAAFA was established in New York in 1969, and their stated mission is to change perceptions of fat and end size discrimination through advocacy, education, and support. To this day, they continue to support equality at every size, and they have fought for laws that protect against weight discrimination as a civil right. Around the same time that the NAAFA was finding its bearings in New York, Californian feminists decided to also start their own movement called the Fat Underground. Rather than solely asking for policy changes related to liberation of fat people, these women wanted to see a change in the way that society placed value on, revered, and even feared women according to their body sizes. They would do things like show up to diet meetings and present facts to the presenters about why dieting is totally a scam. And I say good on these women because diet culture is a scam. And in general, they were seen as a more radical arm of the fat acceptance movement. In the modern day, fat acceptance is a hot topic on social media. For the purposes of this video, I'm mainly going to be focusing on TikTok, just because that seems to be the social media platform that's most trendy with this movement these days. The hashtag fat acceptance has 162.5 million views, followed by hashtag fat acceptance movement with 718,000 views and hashtag radical fat acceptance at 44,000 views. From its inception, fat acceptance has been a controversial topic. What's interesting is that people who are fat, as well as people who aren't fat, are divided all around on whether or not it's a good or a bad thing. Supporters say that this movement is necessary for combating anti-fat discrimination that is present all throughout society, while opponents say that fat acceptance is akin to telling people that being overweight or being obese is healthy when it really isn't. I want to point out that even though I'm drawing a clear line between two different groups, there are more than two groups in the fat acceptance community. I would say people don't necessarily agree on what the definition is or what all it encompasses, but those are pretty much the two dominant theories that I've come across in my searching of the internet. Let's take a look at some TikTok videos so that you can see what I'm talking about. This video is by Splotchmaker.
I'm answering questions off of my story right now, and one of them was, when did you realize it's okay to be fat? So actually in 2018, I was on sort of like a weight loss kick trying to do that. And then as I got into 2019, the beginning of 2019, my body started changing. I started gaining a little bit of weight, and I was like, really struggling with internalized fat phobia because my entire family has taught me from birth, just picked apart my body, said fat is horrible. But my body was changing, so I needed to dress it. I've only thought about the origins of how I unlearned it or the inciting moments a few times, but it really was just fat fashion and fat influencers who post fashion outfits or daily life content. I started watching Emma Thompson Hill in 2019 to kind of figure out clothing hauls and like where I could get clothes that fit my body now that I wasn't straight size. And I had never seen a fat person that was happy. Never. I didn't think that was a thing. Because at that point my social media was just full of before and after weight loss pages and things like that. So like I was just really in this environment at home and online that was really fat phobic. I watched more of her videos, I followed her, and I followed other fat creators, and I had a moment to myself. I'm like, they look good when they're fat. They're not supposed to look good when they're fat, but they do. Many of y'all, being fat is your biggest fear. That's embarrassing. Unpack that. Or just stay confined to the thin ideal.
That's another phrase that comes up a lot in these videos too. This dichotomization between being obese and being thin. So there's a lot of commentary about thin privilege or holding up the thin ideal. But I do want to remind all of us collectively that it's not a matter of being obese or being thin. There are healthy weights in between that too. Okay, this next video is by Ilsa's Endeavors.
Actually, I do want to be fat because bellies are beautiful.
This next clip is by Name 3 Songs.
We've been conditioned to think that thinness is good and fatness is bad, when that's not the case at all. It's no indicator of health whatsoever, which we know now. But this is so intertwined in our society of fat is bad, fat is bad. We're just being fed this our whole lives, and it's affecting us on so many levels. It's important, like, as we have this conversation, to look back at what is this history of fat acceptance, because there's a lot of like body positivity stuff happening right now. And like, that's not where it started.
She's right. Body positivity did stem from the fat acceptance movement. The thing I didn't really agree with is when she said that weight was not correlated with health at all, that it wasn't related to any health outcomes at all. And as someone who works in research, it really sucks when we work so hard to collect data and do these studies and create this body of evidence, and then people just like come and kick it to the side. It hurts. All right, let's hear from Hannah Talks Bodies.
I can always identify someone who doesn't have a great grasp on history if they see medicalization as a stamp of inherent virtue. This comes up a lot when I talk about how the word obese is a slur. At least one person will always pop their head out of the ground to say, obese is a medical term, as if that somehow makes it better. You know what else used to be a medical term? Like a lot of we don't say anymore, because we realized it was stigmatizing as fuck and it actively harmed people. You can Google them, I'm not going to say them here. Science and language are both constantly evolving and updating. The medical establishment is not exempt from this. If anything, it's actually a particularly strong example of how this happens. We don't need to look too far back into history at all to see how medical terminology and practices change. For example, homosexuality is no longer diagnosed as a mental illness. Female hysteria is not something that's diagnosed anymore. Cocaine and heroin are no longer prescribed as anesthetics or cough suppressants. Lysol cleaning spray is no longer used as a douche. We don't perform ice pick lobotomies anymore. And doctors no longer advocate for the health benefits of smoking cigarettes. Oops. More importantly, when a marginalized group tells you that a word or practice harms them, you can just go ahead and believe them.
While it's true that medical knowledge and language evolve over time as we progress as a society, the term obesity is still a valid medical classification, and it's important to have cutoffs and different categories for things because it helps us to make good clinical decisions as people working in the healthcare field. For example, when the COVID-19 vaccines first came out, obesity was used as one of the criteria to decide who was going to get the vaccines first, because people with obesity were getting infected and dying at higher rates than people who did not have obesity. One more video by Half.phd.
Growing up, I felt really justified in hating my body because fatness is always framed as this public health concern. And I think this narrative is perpetuated that, like, if you are not actively trying to lose weight at all times, you do not care about your health, and you are going to die because you are fat. But when you start really diving into medical literature and understanding the science that exists between weight and health, you just start to realize that this is not the case. Health is complex and multifaceted, and people can be healthy or unhealthy at a variety of sizes. But I really encourage us to push beyond this thinking anyway, because regardless of whether someone is healthy or not, they still deserve love, respect, basic dignity. Yet people believe that fat people don't deserve this because of their bodies.
I agree. Everyone should be treated equally with respect, with dignity independent of their size. But this is another TikToker who's saying that weight is not associated with health. That is something that I'm going to be addressing later on in the video because this is a nutrition research channel, so I am going to talk about the research at some point, but it's false to say that there's no connection between weight and health. So as I just mentioned, carrying extra weight on your body is a well-established risk factor for several health conditions. What's more is that obesity doesn't simply correlate with these health conditions. It's not just that they co-occur. What we see, not just looking at the raw numbers, but also at the biological mechanisms, is that obesity in many cases causes these conditions and can make them worse. For the sake of brevity, even though I think this video is going to end up being longer than my other ones, I am only going to be talking about obesity, not overweight, which is a separate category. And I'm going to be talking only about obesity in the American Western context. Now, how does someone know if they're obese or if they just have a little extra weight on their bodies? Someone who is classified as overweight has a body mass index or BMI of 25 to 29.9. A BMI of 30 or more places someone in the obese category. This is the subset that is most at risk for the health conditions that I'm going to be discussing shortly. Now, I know that some of you must be wondering, Michelle, isn't BMI an outdated and racist way of assessing people's bodies? Yes and no. What I will say that for now, we can trust that if someone has a BMI of 30 plus and they're not a bodybuilder, then it is likely an indicator that they are carrying excess weight on their bodies and it is something that they would want to address. Okay, so now let's cover some basic statistics on obesity. How common is it and what have the trends been over time? The latest data for the United States comes from the 2017-2018 National Health and Nutrition Examination Survey, or NHANES. It shows that 42% of adults and 19% of children are obese. Quick side note about assessments for childhood obesity. For children, we don't use the straightforward BMI calculation. Instead, we use growth charts. So if a child's weight is above the 95th percentile when compared to their peers of the same age and sex, then that is when a child would be considered obese. The prevalence of obesity has been steadily climbing decade after decade. 20 years ago, 30.5% of the adult population was obese. Now we're at 42.4%. For children, the stats are even more worrisome. In the 60s, the rate of obesity for children was around 5%. Now it's quadrupled to around 19%. All of this is truly concerning and not at all overblown because obesity is associated with several life-threatening health conditions. Among these, heart disease, some forms of cancer, stroke, type 2 diabetes, sleep apnea, gallbladder disease, and osteoarthritis. What's even more alarming to me as a dietitian is that we're starting to see more and more of these conditions in children. Back in the day, type 1 diabetes used to be called juvenile diabetes because you really wouldn't see children with type 2 diabetes. Now, children are being diagnosed with type 2 diabetes, and that's just one outcome that is increasing in children in tandem with this increase in obesity. Now, I want to take a moment to kind of dive a little deeper into these health conditions to really show you why it's not just a matter of correlation, but it really is a matter of causation. First, let's talk about osteoarthritis. Osteoarthritis is a degeneration of cartilage and bone in our joints. In addition to causing stiffness, it can also be quite painful. Studies show that obesity increases the risk of knee osteoarthritis through several mechanisms, such as increased loading of the joints, inflammation, changes in body composition, and behavioral modification. This last factor is somewhat of a vicious cycle, as obesity can limit mobility and make it hard to exercise. And this lack of movement can in turn weaken the muscles that protect the knee from damage, and so the joint gets weaker and weaker over time. Losing weight is known to reduce the risk of developing knee osteoarthritis, and if you already have this condition, losing weight can help to take some of the load off of that joint and slow down disease progression. Another really common side effect of having obesity is sleep apnea. Obstructive sleep apnea is a condition characterized by recurrent episodes of the upper airway muscles relaxing and blocking the upper airway, causing a momentary pause in breathing, which is brief but severe enough to interrupt sleep and cause intermittent hypoxia, also known as low oxygen levels. Obesity is a risk factor for obstructive sleep apnea, and they actually interplay with one another. In other words, these intermittent breathing interruptions that are associated with obstructive sleep apnea have been shown to worsen the metabolic dysfunction that is already associated with diabetes. Here's a third thing that we should be concerned about: gastrointestinal complications. Obesity also causes or greatly increases the risk of numerous gastrointestinal complications. Among these, gastroesophageal reflux disease, erosive esophagitis, Barrett's esophagus, esophageal adenocarcinoma, erosive gastritis, gastric cancer, diarrhea, colonic diverticular disease, polyps, cancer, liver disease, including non-alcoholic fatty liver disease, cirrhosis, hepatocellular carcinoma, gallstones, acute pancreatitis, and pancreatic cancer. Concerning item number 4 is type 2 diabetes. This one is probably a no-brainer. I think it's probably the one that is most talked about, or maybe the second most talked about after heart disease, but obesity is a risk factor for type 2 diabetes. This is because when we gain weight, the number and size of our fat cells increases, and this affects the substances that they release. Remember, our fat cells are not just sitting there. They are biochemically active, sending out signals to the rest of the body constantly. Some of these substances are called adipokines, and I want to highlight 2 of them: leptin and adiponectin. Leptin helps us to burn fat and keep our blood sugar in check, but its effects are reduced in obesity due to a reduction in receptors for leptin. The body keeps producing leptin, but it can't do its job, and so we become less efficient at burning fat and maintaining our blood sugars where they should be. Adiponectin, on the other hand, is reduced by obesity, and this in turn promotes insulin resistance, a major risk factor for type 2 diabetes. Fat cells also release lysophosphatidic acid, or LPA. LPA helps to regulate cell growth and survival, the flexibility of our blood vessels, and blood sugar stability. As you guessed, obesity interrupts these processes too. Cells with too much fat in them also respond less effectively to insulin, the key that unlocks the door for glucose to enter our cells and be used for energy. Basically, obesity changes our biochemistry in a way that favors metabolic dysfunction and can produce type 2 diabetes. All right, next let's cover a big one that I think is still relevant even though the pandemic seems like it's kind of dwindling down: COVID-19. The Centers for Disease Control and Prevention, or CDC, identified severe obesity as a risk factor for having a worse prognosis, higher rates of respiratory failure, a higher need for mechanical ventilation, and higher mortality after infection with COVID-19. This is because the virus penetrates human cells by binding with angiotensin-converting enzyme, or ACE2 receptors on the cell surface. ACE2 expression is higher in adipose or fat tissue than it is in lung tissue, which means that the virus has an easier time wreaking havoc on the bodies of people who have a larger volume of fat tissue. All of these healthcare issues not only lessen the quality of life of the people who are suffering through them, but they also contribute to healthcare spending. Annually, $190 billion are spent in the United States on obesity-related healthcare expenditures. That figure accounts for direct costs such as surgery, as well as indirect costs such as lost wages. By now, I think it's pretty fair to say that obesity isn't something that we want to normalize or treat as innocuous. So then the question becomes, how do we handle it, and have we been handling it well? While perusing TikTok, I found several videos that highlighted the reality of weight stigma in the medical profession. Unfortunately, some medical providers go the route of shaming or trying to scare people into losing weight, and that's not helpful for anybody. Let's take a look at this first video by the Simone Mariposa.
Hey y'all, so I want to share a little bit about something that I literally just experienced. So I've been having menstrual cycle issues, and it's presented a problem more recently, like in the past couple of months, and I'm starting to get concerned. So I decided to make an appointment with my gynecologist. Now, before that appointment, I have a phone visit with the doctor to tell him my concerns so that we can maybe pinpoint some things before I go in. So I tell him that my period's been super irregular and it's not something that I commonly experience, so I wanted to talk to the doctor about it. Then he asks me how much I weigh. I tell him the number, and of course, because I'm fat, the number is up there. He immediately says, oh, well, I'm sorry to place all the blame on the weight, but being overweight can present a lot of hormonal imbalances and different issues. So I think that's the problem. I quickly interject and I'm like, sir, I've been fat my entire life, and I'd be more concerned if this had been an issue since I started menstruating, but this is recent. So I'm not comfortable with just assuming that weight is the issue. I would like for there to be more things done to see if there's an actual problem besides my weight. After that, he agreed, and he ordered some blood work to be done and for me to get an ultrasound to see if there's anything more serious going on. Now, I know this seems like a simple interaction with a doctor, but it's kind of scary to me. It's scary because I feel like if I hadn't asserted myself and said something, who knows if the doctor would have even been willing to see if there was a deeper issue beyond how much I weigh. And on top of this, I didn't even see the doctor in person. So this is all based on what I'm telling him. And I just imagine how other fat people feel and the fear that they experience going to the doctor because a doctor may not even listen to them because they're fat. For me, I'm grateful that I have the vocabulary to be able to say something and to get a doctor to hear me out, and that I am even confident enough to speak up, because that's not really a common feeling to have. And that's why I have this platform, to empower people to say something when they don't feel comfortable with what someone in authority is saying, because they're only viewing you as a fat person and not as a person who has issues beyond that, and not even to say that fatness is an issue, so to speak.
Yeah, it's definitely disheartening to hear stories like that because she's right. All right, this next clip is from Shay Sink.
Hey, Candace, I'm Nurse Joy. I'm going to be a nurse today. Can I take your blood pressure? Yeah, that's fine. Go ahead. Okay, I'm going to just try to put this on your arm. Looks like our cuff isn't big enough. Can I do your forearm? Do you mind that? I mean, you guys don't have, another cuff that's bigger, for bigger arms. If not, I can literally just do this arm part, the forearm, but, I know you guys like accurate readings, right? You know what? We do. Actually, right here, yes. See if this works for you. Okay, this is the same. You know what? We could just do it on my forearm. It's perfectly fine. It's fine. My blood pressure hasn't been bad lately anyways. Once again, I'm so sorry about that, okay?
I empathize with this person because you don't want to go to the doctor and feel like they don't have the right tools to measure you, to assess you. Not a great feeling. All right, this next clip is from the J. Salazar.
Oh, my big people, hear me out. This past year, I got a new primary care physician, and he has been incredible. I've avoided the doctors for a long time because they say the same thing. You're fat, lose weight. You're fat, lose weight. This is what's happening because you're fat, lose weight. Even if it might be a little true or even mostly true, right? The fact is, we don't get listened to because they always lean on fat. So we don't get listened to. We don't get heard. So there's so many things that fat people are missing medicine-wise, health-wise, because doctors don't listen to fat people. They don't. My doctor today, I went to him for my back pain. He was like, yo, you should have came early. You should have let me know. He said, I can give you this medication to decrease the inflammation. Oh, I'm going to write you a prescription for an x-ray. I'm going to do this. I'm going to do that. And then he was like, you're going to do all this and come back in 10 days and let me know how it feels, right? He said, because I know how doctors are. The first thing they're going to say is lose weight, come back. He said, no, we're going to figure this out together. Man,
I love this one because this is how interactions with your healthcare provider should be. You should feel listened to. You should feel valid when you step into that office. And I love that this person had a good experience to share with his healthcare provider. And I want to underline something else that he said too that I think is important. Even if the weight is connected to what he's going through, it is so important to do a thorough assessment because you just never know. The human body is so complicated. There's so much that can go wrong with the human body. So it is wonderful to see he was able to get the care that he deserved to get, that we all deserve to get. All right, this next one is from Valerie Online.
Hi, heard you're not feeling too good. Okay, well, let me take a look. So the nurse wrote down you're experiencing fever, chills, cough, shortness of breath, fatigue, muscle and body aches, sore throat, congestion, runny nose, nausea, vomiting, diarrhea, and you lost your sense of taste and smell. Is that right? Okay. Well, good news. I see what's going on here. So basically, you are what we call in the medical community morbidly obese. Now, with that being said, all you have to do to lose these symptoms is drop 175 pounds. You'll be back to normal, good as new. Okay. So what I'm going to do is refer you to a nutritionist who's going to be talking to you about something called the food pyramid. Pretty cool. So yeah, I'll get my nurse up. Okay, so it turns out you did actually test positive for COVID-19. So with that being said, just quarantine for 14 days. I'll write you some scripts and you should be back to normal. Yeah. All right. Later, fatty.
Yet another, unfortunately, common situation that I'm sure many people can resonate with. I do want to point out though that we do not use the food pyramid anymore. We have My Plate now. All right, next video is from Gigi Peach.
Tell me why the computer tells me that it's the address for Marineland.
Long story short, a patient came in to get an MRI at a hospital that this guy worked at. Patient didn't fit in the machine, allegedly, and so they referred the patient to another place where they would have a machine that would accommodate them with their size. Dude looks up the address for them because they're like, it's far away, where is it? And he sees that it's whatever it was called, like Marine Life Land or whatever the basically the machine that they use for like the dugongs and other large mammals. He also says that he's not going to tell the patient what the place is. Anyway, one time I needed like some kind of scan or whatever, and they were like, you're not going to fit in the machine, which is bullshit because the week before I did fit in the machine and I had not changed weight at all. This doctor was just horrifically fatphobic. And so they were like, here's a referral to go and get the scan elsewhere. And I was like, oh, do you have any recommendations? And they were like, try the zoo.
This experience, it seems like it really comes down to a communication breakdown, the provider not being able to properly communicate to the patient what's going on, for the patient that apparently needed to be weighed outside the hospital at a different facility, and also practitioners making assumptions before at least checking to see if patients can use the machinery that's available. That's tough. So yeah, like it sucks that these people had to go through these things. For the most part, there were some positive stories in there, but I think it's great that they're sharing their stories online because with awareness, we can hopefully get to the next step, which is adjusting the things that we do, the way that medicine is practiced, the way that the whole system works, so that everyone can feel included and feel comfortable and not avoid going to the doctor, because who knows how many people are in the same situation as I think it was Jay Salazar who mentioned that, who are in the same situation where they're avoiding seeing a doctor at all because they're so tired of facing this weight stigma. Personally, in my own practice, if a patient tells me or a client tells me that they don't want to be weighed, that is a-okay. Because honestly, as a dietitian, my job here is to help you to have a healthy relationship with food. It's to give you knowledge that you're going to use to build your own healthy habits that work for you. If weight loss is a consequence, great. That really is up to you to determine if you want that consequence, if you care to measure it or not. The information that I give you is the same regardless. Now, this weight stigma is closely associated with another term that gets used a lot, which is fat phobia. People who advocate for fat acceptance tend to also advocate for the point that we live in a fat phobic culture. So let's talk a little bit more about that. Fat phobia, as the name implies, is a fear or aversion to fatness. I think it's undeniable that there are look hierarchies in this country, and people who are very large typically are not at the top. So I do give points to the fat acceptance movement for trying to get rid of any type of prejudice or stigmatization that people may be facing for whatever reason. I think that's fantastic. But something else that kind of doesn't sit too well with me is that it seems like sometimes this word is being misused, like in this situation here. This video is by It's Mary Fran.
Welcome to our hotel's Fatphobic. With me, your host, your resident Mary Fran. Come hither. Let's take a look at the bathroom. As one might see, it looks normal. Would you like to take a pee or a poop? Don't worry, you'll barely fit. Perhaps a shower. Oh, need a towel to dry off? Don't worry, it won't fit. Oh, yes, so nice. I'm ready to go outside. my attention.
It's clear that she's making fun of the situation, which is great. She's being humorous, but she uses the word fatphobic to describe the hotels. I think it'd be more fair to say that they're just not equipped or that they don't have the right accommodations for people of a larger body size. And I think that that's just something that we can expect living in a society with a variety of people. So I'm going to draw a parallel, and I know that some people might argue that it's not a fair parallel because it's something that is less stigmatized, but my parallel is my shoe size. So I am a tall woman. I'm 5'9", well above the average. I think the average female height in the United States is like 5'4", 5'5", or maybe less than that. But I am taller than the average woman, and my feet are, well, proportionally larger than the average woman's feet. So a lot of times when I would go shoe shopping, I would literally have to go from store to store to find a store that would have shoes in my size. But it never occurred to me to see that as discrimination or Bigfoot phobia. To me, it's just, I get that I'm kind of an outlier, so I'm gonna have a harder time finding the things that I need, but I will keep looking and eventually I'll get what I need. So I think that calling a hotel fatphobic is a little bit of an overuse of the term. Let me know what you guys think in the comments. When is it fair to call something fatphobic, and when is it just a matter of needing to adjust expectations and not expecting life to always be accommodating? Here's another example where the term fatphobic or fatphobia is used, and I don't quite agree with it. This clip is by Mallita Gordita.
I hate to tell you this, but actively not wanting to be fat is indeed fatphobic. Also, your statement just indicated that people who work out are also people who do not want to be fat. Did you know that fat people work out without wanting to become thin? Did you know that you can work out for reasons other than wanting to change your physical appearance? The fitness and diet industry has absolutely perverted what exercise is and what it is good for, like mental health and cardiovascular health. The industry has brainwashed us into thinking that we can micromanage and control our bodies and exactly what every part of our bodies look like. Sure, you can control your body to some extent, but not through healthy means.
I think people should be at liberty to exercise for the purpose of weight loss and not be seen as bigots of any kind. People who exercise to lose weight are not simply running away from fatness. It's not out of a fear of fatness. They're running towards things that they know that they want for themselves. For instance, they could be running towards being able to go on vacation and go up a flight of stairs without getting winded easily so they can keep up with their kids. They could be running towards being able to put on their socks and shoes without the help of somebody else. Or they could be running towards that sense of achievement that we get when we accomplish any difficult task in life, be it weight loss, getting a degree, you name it. And these are all things that clients have said to me after losing weight. It had nothing to do with them disliking fat people or hating fat people. It was just about them wanting to achieve certain things that they knew they could only achieve through weight loss. All right, here's another video by Dayton Carey.
Hello, we're twins. We're twins. Yes, sir. I am me. She is she. Except when I pretend I'm her. And when we switch, you can't tell which is which.
So this is a little bit of an older video, but I think it's still relevant because people still talk about Adele and she's still an awesome musician. So when Adele lost a ton of weight, there seemed to be division about how the public felt they should react to it. Of course, this really is Adele's business, but she's a celebrity. People get into her business. These are things that happen. And so there were some people who are saying, you know, good on her. She lost all that extra weight. She looks great. Other people were saying, we shouldn't praise Adele for losing weight because that is akin to fat phobia, and that's the message that's being expressed in this TikTok clip. I don't agree with it. I think that if somebody feels like this is inspiring to them, or they think that she looks great now, that she looks healthier now, so what? It's not a matter of hating somebody who is fat or fearing somebody who is fat. It's a matter of giving somebody kudos for something that they work towards. And I think that that should be okay. This other TikToker, Hoff.phd, posted a video that was in a similar vein.
I highly discourage people from posting before and after photos, whether it's in the domain of weight loss, weight gain, or if they're trying to make a statement about how their body did or didn't change in some way. When you post before and after pictures of weight loss, that can be incredibly troubling for people who suffer from eating disorders or other kinds of body dysmorphic issues. It also implies that you were less of a worthy person in your before photo, which is incredibly insulting to people who look like your before photo. On the body positive side of things, when people post before and after pictures of how they looked when they had an eating disorder versus when they gained weight, you're doing the exact same thing. All around, it isn't a good look, so stop doing it. If your intent is just to show that you're happier now, just show that you're happier now.
We know that places like Instagram and TikTok are just places where people go to show their happiest moments in life and brag a little, and that's what human beings do sometimes. So to tell someone that it's a negative thing to post it before and after is just very strange to me. If someone works hard to lose weight and they want to post about it, good for them. You have no idea how hard it was for them to get there. You don't know what that shift means for them, why they chose to post it. Asking people not to post their pre and post photos because there are people who still look like their pre photos is like telling people not to post when you get a new job because there are people who are unemployed. You could use that argument with any achievement. There are always going to be people who have it better or worse, but it depends on how you're assessing it. All right, enough of TikTok. To get some more opinions on this topic, I decided to peruse Reddit. And of course, there was a division of opinions, and I'm gonna read some of the posts that I found to be most interesting to you. This post says, I escaped fat acceptance and realized that actually taking care of my body helps my depression. She goes on to write, I used to be so deep into the fat acceptance movement. What a joke. I found myself turning 21 and I was a 300-pound, 6-foot woman, clinically morbidly obese. Seeing that 3 was a huge wake-up call. I made an Irish exit and started walking 1/4 mile every morning. That's it. No gym membership or complicated workouts. I didn't even change my diet, and the scale started to very slowly tip back to the left. The fat acceptance movement is so dangerous. I was overweight, out of shape, depressed and vulnerable, and they saw that in me and used it against me. If you're trying to start moving, do what I did. I only walked 1/4 mile a day and was dry heaving at the end, and I recently finished a 5K for the first time. At it, I realized that the original purpose of the fat acceptance movement was essentially an anti-bullying movement. I agree with this. Nobody deserves to be singled out because of their weight. But digging deeper shows how much of a slippery slope care for and love yourself no matter your weight turns into being fat is objectively good and healthy, and whoever disagrees is fat phobic. Fat people shouldn't be the target of hate, but telling people that objectively unhealthy choices are healthy is even worse. Here's an example of somebody who was morbidly obese, who was initially following the fat acceptance movement and took that movement to mean accept myself as I am at present and do nothing to change. And she realized that that was not helping her. Another user posted something similar. I hate that I, 28 female, joined the fat acceptance movement and let my health suffer the consequences. I want to say that, first of all, I believe wholeheartedly in body positivity in an appearance sense. The distress of hating your body leads to harmful behaviors and is unhelpful. But I have really messed myself up here. I dove headfirst into self-love and fat acceptance after years of battling with my body. It felt so liberating, amazing, and the weight piled on. Fast forward a few years and now I'm stuck pre-diabetic, recently had an AKI, yes, it's an acute kidney injury out of nowhere. I have a hiatal hernia and a fatty liver. My knees are arthritic and my PCOS, polycystic ovarian syndrome, symptoms are way worse. I'm miserable and my self-confidence is at an all-time low. I just wish someone had told me I could live healthily without it being focused on being skinny or looking thin. Then I absolutely could eat healthily while having the occasional treat and get to a healthy weight. That my life didn't have to revolve around eating crappy food all the time. That weight absolutely does contribute to health issues. I'm just so mad at myself for doing it. I'm scared for others who get sucked in. I'm still in my 20s and yet have faced so many health challenges, and if I don't change, there'll be more to come. So here's yet another example of someone who was overweight or obese themselves, got sucked into the fat acceptance movement, interpreted that movement to mean I need to accept myself as I am here now and do nothing else, and ended up regretting that decision. But of course, it all comes down to how people internalize the message and how they interpret it. There are users who also post about why there shouldn't be such a thing as fat acceptance. This person posted, I don't understand why the fat acceptance movement is a thing. Just to clarify, I do not condone bullying or ridiculing obese individuals. I do not understand why we are telling fat people that it's okay to be fat. Obesity is a real issue with real problems. It is in the best interest of obese individuals to take control of their weight if they want to live long, healthy lives. They got the root of what the fat acceptance movement was supposed to be, and they also got to the root of what it kind of seems to have turned into. This other person says, we should stop with the fat acceptance movement. I'm not saying to start being mean or disrespectful to overweight people. I think they meant to say, but we shouldn't encourage or say that it's perfectly fine to be overweight. It's unhealthy, and we shouldn't raise a generation of kids to accept that being overweight is perfectly fine. So again, even if the root message of the fat acceptance movement was, hey, don't treat us poorly, treat us with respect, what it seems to have turned into, or at least what the message that a lot of people are getting, is that fat is equal to healthy and nothing should be done if a person is morbidly obese. This last Reddit post, I think, summarizes pretty well the best approach to fat acceptance that I've seen so far on Reddit, so I'm going to read it to you. If you hate yourself because you're fat and that causes you to binge eat as an emotional coping mechanism, then fat acceptance is the first step in losing weight. Only when you accept that your intrinsic value as a human being is not tied to your weight will you not need to emotionally eat. That is, in many cases, the first step of losing weight if you are an emotional eater. It's loving yourself as you are, even though you are flawed, in this case in your eating behaviors and emotional coping mechanisms. The second step is changing that behavior because you now have the love for yourself necessary to motivate it. This initial self-love is what the fat acceptance movement is, in an ideal world, about. I really like this approach because I think it's so true. Food is not just nourishment. Food is not just sustenance. Food is so heavily a psychological thing. We all use food for comfort at some point. We all use food as a way to deal with emotions at some point. And some of us do use food in a maladaptive way that can end up harming our health. And I think that what this user is saying is absolutely true. If you don't love yourself first, why are you going to want to improve anything about your life? Not even just talking about your weight. Why are you going to be motivated to do anything if you don't love yourself, if you don't think you're worthy of having anything better? It all starts with your mentality, and you have to want good for yourself. You have to care about yourself to then take the next steps that are necessary for you to live a healthier life. So that's the major Reddit takeaway. Going back to what I said at the beginning of the video, these Reddit posts, as well as the TikTok videos that I showed, really underline the point that the fat acceptance movement is not a coherent movement. There are people who are expressing the ideology differently, and then there are different interpretations of what it means. For some people it helps, for other people it hurts. Some people take it as fat promotion, while other people take it as just saying like, hey, let's treat fat people as humans too. Ultimately, I think that nobody should have to wait to feel worthy of receiving love and feel capable of giving love. Life is really just too short and fickle for that. You should work on loving yourself in the now. And if loving yourself means wanting to lose weight so that you can be able to achieve X, Y, or Z thing that's important to you, good for you. If loving yourself means staying exactly as you are because you legitimately are happy with the way that you are, also good for you. And that brings me to the end of today's video. Thank you for watching, and please subscribe for more nutrition and health content.